From the PEP Radio Newsroom, we have a fact check about the suspected drug vessels in the Caribbean. President Donald Trump has repeatedly claimed that military strikes on suspected drug boats his administration has been carrying out for more than 2 months in the Caribbean Sea and the Pacific Ocean are saving the lives of hundreds of thousands of people in the United States. But experts say that this is a grossly simplistic interpretation of the situation. Trump: every boat we knock out, we save 25,000 American lives. However, the numbers to support Trump's claim don't add up and sometimes don't exist. For example, people in the United States who die from drug overdoses each year are far fewer than the amount Trump suggests have been saved by the boat strikes his administration has carried out since September. The statement that each of the administration's strikes on alleged drug smuggling boats saves 25,000 lives is absurd, said Carl Latkin, a professor of public health at Johns Hopkins University who studies substance use. The evidence is similar to that of the moon being made of blue cheese. If you look carefully, you see a resemblance. However, a close analysis of this claim suggests that it lacks all credibility. According to the latest preliminary data from the Centers of Disease Control and Prevention, there were about 97,000 drug overdose deaths in the United States during the 12-month period that ended June 30th. That's down 14% from the estimated 113,000 for the previous 12-month period. Final CDC reports indicate 53,336 overdose deaths in 2024 and 75,118 in 2023. The U.S. military has attacked 21 boats in the Caribbean Sea and Eastern Pacific Ocean since strikes began on September 2nd, most recently on November 15th. Using Trump's numbers, that would mean the strikes have prevented 525,000 fatal drug overdoses in the U.S., far more than the number of overdose deaths that have occurred in the recent 2-month periods. This essentially implies that the administration is saving more lives than would have ever been lost. Lori Ann Post, the director of the Institute for Public Health and Medicine at Northwestern University, explained that there's no empirically sound way to say a single strike saves 25,000 lives, even if the statement is interpreted more broadly to mean preventing substance use disorders and resulting ripple effects. Among the issues she pointed to are a lack of verifiable cargo data or published models linking such boat strikes to changes in drug use, as well as markets that will adapt to isolated supply losses. That's what we know for now. Reporting from the PEP Radio Newsroom, I'm David Moore.